Hi, welcome to Fostering Resilience. I'm Dr. KJ Foster. In today's video, I'm sharing with you information about DBT, which stands for Dialectical Behavior Therapy, as it relates to addiction, trauma, and something called BPD, which is Borderline Personality Disorder. And I'm also sharing with you something that I have never shared before. At least I've never shared it publicly. I've definitely shared it with only a few people, therapists, and a few very close friends, and I've actually shared it with some of my clients when it's been appropriate. But I've never shared it publicly. It's not something that I talk about very often, but I feel that it's going to hopefully be beneficial for someone for me to share this with you today, because I am at the point in my life where I'm not retiring. My husband's retiring from his job and I am leaving my job. We both work together at a treatment center. He's the program director, I'm the clinical director and family program director, and we're moving to France. So he's retiring. I'm going to continue to do this and also my private coaching online and things like that. But we're leaving our full-time jobs. And so I'm at the point where I'm not worried anymore about what people are going to think or what people are going to say, because that is basically what has been holding me back all of these years from talking more publicly about this. And this is what the big problem is with mental health issues, is that there is such a stigma associated with this. So what is this all about? Well, let me start at the beginning. When I was a child, from the time that I can remember, from a very, very early age, I had significant difficulty regulating my emotions. I would go from 0 to 1,000 in a split second. I can give you examples of time after time where I would emotionally escalate and create this huge situation, let's just say. Okay, I'll give you one example. I remember one time when my mother came over to the next door neighbor's house, and I lived next door to a family of 3 girls and one the same age as I, and then the other 2 within a couple of years. And we were all playing in the backyard, swinging on the swing set. Perfectly nice afternoon, perfectly nice time that we were all having together. But my mother and father were going somewhere. I can't remember the specifics of this situation, but my mother came into the backyard of the neighbor's house to ask me to come home. Well, I didn't want to go home, and I pitched such a fit to the point that my mother had to literally drag me from the backyard to my bedroom in the house. And I still remember her face, her being so just exasperated, not knowing what was happening, what to do, what was going on. And this is only one example. I mean, I would have fits in my room, fits of rage, throw things against the wall. I remember I threw something and it went through the wall of my bedroom. I mean, just really emotional outbursts that were pretty scary, not just for my family, but they were really scary for me, because as a kid, I didn't understand. I didn't know what was happening within me, and I never got help for it. I remember at one point my parents sat me down and they said, listen, this has to stop. You cannot continue to do this. And if this continues, we may have to send you somewhere. And I remember thinking to myself, they're going to send me to a psych ward or something. And I remember being very afraid, very scared that they were going to, and of course, as you may already guess, what this is leading up to is that I am someone, hold on. All right, I had to get myself a tissue and compose myself. I apologize. But it's really hard to even say the words. It's really hard to bring myself to share this with you. But again, I think that it's important to do so. But I am someone who has suffered with borderline personality disorder the majority of my life. I mean, my whole life. But the majority of my life, I didn't know what it was. And that's the real sort of tragedy about it, is that I had no idea what was wrong with me. I just knew that there was something wrong with me. And there's a lot of shame that comes with that, which is why, there's a reason why people choose to study the things they study in school. There's a reason why people choose their professions. And so I remember in college, I entered college as an accounting major. I was really good at accounting, but I switched majors my first semester in college because I took psychology for the first time. And that was when I took those psychology courses. First of all, it was one of the first courses, aside from accounting, that I was able to achieve an A in. And it also helped me to understand so much about myself, about my family. And I didn't discover the borderline personality disorder yet, but I was starting to understand, and I was fascinated by it, and I also was inspired to want to help other people as well. And yet, I didn't enter into the field until my recovery. I didn't enter into the field of mental health, even though when I was working for a large, let's just say I was in the hospitality industry, and it was during the first few years, and I was working in human resources, and I had a mentor, a woman that I worked for, who was wonderful, and she suggested that I go to get my master's degree, and she suggested that I go get a master's in organizational development. I think it was organizational something. I can't even remember, but it had to do with like human resources. And I started the degree in organizational management, but then I switched to mental health because I found the classes on the mental health track to be so much more interesting. And once again, they were speaking to me. And they were telling me things about myself and about my life, and they were helping. It was like my own therapy in a sense, because I grew up in an environment where you didn't go to therapy, you didn't even share what was going on within the family with people outside of the family. So, and that was only, that's nothing to say against my parents. Like, that was the era that they grew up in. That's what they were taught. So we passed down these rules, so to speak, within our families, right? You don't talk about things, you don't, seek therapy. So it wasn't really until a lot later in my life that I started to learn this is something people do. People go and get help for the issues that they have. And at that time, that was helping me with issues that existed at the time within my marriage. And so I can tell you one thing about borderline personality disorder. If you wind up getting paired with someone who either is narcissistic personality disorder, which codependency is another one of my issues. That was my first big discovery, was early on in my recovery process. That was the first aha, like discovering that I was suffering from this codependency. So codependency definitely, and narcissistic personality disorders often get paired together. They're attracted to one another. But if you're someone who is struggling with borderline personality disorder and you get paired with someone who has anger issues or someone who's a narcissist or both, you're going to have a very toxic, unhealthy relationship. Like, there's going to be a lot of chaos. But that being said, I think that at that point in time in my life, it wouldn't have mattered like who I was with, that I was very unstable within myself. And there were all of these characteristics of the borderline personality disorder that I didn't know that was what was going on within me, and then you have people that are just thinking you're crazy. Or even within my own self, I'm like, I'm just a crazy person. Like, I don't know what is wrong with me. And there's only so much of it that you can attribute to like a menstrual cycle or having a bad day, right? Before you're like, I'm just crazy. Like, there's something wrong with me. And people might say, and this is where the judgment and the shame comes in, that, you know, oh, but you are, right? And that's just really unfair and unkind, because the truth is that, yes, is there a genetic component to BPD? Absolutely, there can be, but it's much more likely, and I think it's definitely the case with me, that it's associated with childhood trauma. And, you know, my biological father died when I was very young. There's definitely trauma there from my childhood. So that's a more common factor, childhood trauma or any trauma for that matter. So the bottom line is that this is something that I've been suffering with my whole life. And I remember when I started to seriously, I achieved my master's degree, became pregnant, never wound up going into the field. It wasn't until I experienced my addiction and then ultimately started to recover from that addiction to alcohol, which, by the way, co-occurs quite often with BPD. That's very common trauma, which is why this is all about addiction, trauma, and BPD, because they co-occur. It's very often that these disorders co-occur together, or one leads to the other, or vice versa, but it's very common. And so it wasn't until I started to recover from my addiction and I went back to school and I started learning these different disorders in the DSM. I remember that my supervisor gave me lots of material on borderline personality disorder, and I remember reading it and thinking, this is me. Like, this absolutely applies to me. But I was so afraid to mention it to her because in my mind I thought, do they allow people who have BPD to become therapists? Like, I thought that it would hold me back. And mind you, at this point, I'm older and I'm more high functioning, especially, you know, you put down the alcohol and your BPD is going to get significantly better in and of itself just by doing that. But it's not going to, there's still going to be some significant symptoms. I mean, even when I married my husband and I knew by then that this is something that I'm experiencing, I had already started with the DBT, the dialectical behavior therapy, self-applied. I was terrified to tell a therapist. I was terrified to tell my supervisor. I was terrified to tell anyone, even though I knew this is me. And the thing that's really sad about that is that, you know, when you have any type of an illness, I don't care who you are, I think this applies to everyone, and you don't know what it is, you have symptoms, right? And you don't know what it is, there's so much stress and anxiety that's associated with that. But once you find out that you're not, well, this is debatable, right? People will say, well, you have BPD, so that means you are crazy. That's crazy, right? Because that's not true. This is a treatable illness. Okay, I want to emphasize that. This is a treatable illness. But you could be walking around with this illness and not know that that is what is going on. And that's what you're experiencing. So you don't get the treatment. I was, I think, fortunate enough that within my lifetime, I was able to determine that this is what I'm experiencing, and I was able to self-administer the treatment, which one of the main treatments for borderline personality disorder is DBT, dialectical behavior therapy. Once I started practicing mindfulness meditation and learning about what it means, what dialectical truly means, it helped me tremendously. And I also was lucky enough to meet someone, my husband, who understood my trauma, or I should say, he attempted to understand my trauma. He didn't just sit back and say, oh, you're crazy. he understood that he needed to change the way he was responding to me, and he needed to do certain things to help me to feel secure, because one of the characteristics of borderline personality disorder is this intense feeling of insecurity and a fear of abandonment. Let me share with you the characteristics of borderline personality disorder so that if this is something that maybe you think applies to you, that you'll be able to maybe assess whether this might be going on for you. So let me share that with you before I go into a little bit of information about the DBT. Okay, I needed to grab my computer here so that I could look up these characteristics, because my memory, quite honestly, is really, really shot. It's always been this way since I was little. I have a girlfriend, the girl that lived next door to me, and she has a photographic memory, I believe, not study, go take a test and get an A like that. Not me. I have a very difficult time remembering things. I always have. And so I had to study a lot harder in order to be able to retain things. So that's why I'm not going to attempt to try and memorize this and all the information that I really want to share with you. I could list off the characteristics, but there's more that I'd like to share with you. So this condition, this borderline personality disorder, is a condition that is characterized by difficulties, obviously, regulating emotion. That's a big main characteristic of the disorder. And this means that people who experience BPD feel emotions very intensely. That's absolutely true. And for extended periods of time. And it's harder for them to return to stable baseline after an emotionally triggering event. And this difficulty can lead to impulsivity, poor self-image, stormy relationships, and intense emotional responses to stressors. Struggling with self-regulation can also result in dangerous behaviors such as self-harm. And self-harm can be categorized as anything from cutting to addictions to sexual acting out. I mean, it's a variety of different behaviors that are ways that individuals will act out in order to self-regulate. It's estimated that 1.4% of the U.S. adult population experiences BPD, and that nearly 75% of people diagnosed with BPD are women. Symptoms: frantic efforts to avoid real or imagined abandonment by friends and family. Check. Unstable personal relationships that alternate between idealization, I'm so in love, and devaluation, I hate this person. This is also sometimes known as splitting. Check. Distorted and unstable self-image, which affects moods, values, opinions, goals, and relationships. Check. Impulsive behaviors that can have dangerous outcomes, such as excessive spending, unsafe sex, reckless driving, or misuse or overuse of substances. Check. Self-harming behavior, including suicidal threats or attempts. That one doesn't really apply. That's not something I really ever experienced, except for when I was actively using substances, that feeling of, oh, I just want to die, I just want this all to end. But not really, that's really the only characteristic that I can say that wasn't really pervasive throughout my life. Periods of intense depressed mood, irritability, or anxiety lasting a few hours to a few days. This is where I think that my involvement in sports really helped to minimize this. I definitely experienced this. This is definitely a check. More so when I'm not actively engaged in exercise. So I think that my parents putting me in track and in gymnastics when I was in third grade did a lot to help to regulate. And that was right around the time that we had the sit down, right? The sit down of like, oh my gosh, this has to stop. And I think that my parents were looking for ways like, what can we do with her to help her, with whatever's going on? And putting me into sports absolutely helped that experience. It helped to minimize the depression and the anxiety. Chronic feelings of boredom and emptiness, absolutely 100%. Inappropriate, intense, and uncontrollable anger, often followed by intense feelings of guilt and shame. Absolutely 100%. Disassociate feelings, disconnecting from your thoughts or sense of identity or out of body type of feelings, and stress-related paranoid thoughts. Severe cases of stress can also lead to brief psychotic episodes. I've never had a psychotic episode, but I've definitely had that experience of disassociating. And that was definitely something that I was really terrified to tell people about, because I thought for sure if I told people that I was experiencing that disassociation, even though it didn't happen very often, it was definitely during times of intense stress and usually during an interaction that was very explosive in nature, whether that was an argument or myself exploding and getting angry. And then, of course, for every action, there's a reaction. So whoever that involved, that feeling of then disassociating. So let's talk about some causes. There are genetics, environmental factors, and brain function involved in the diagnosis. And it says that the causes of BPD are not fully understood, but that scientists agree that it's a result of a combination of factors, including genetics. While no specific gene or gene profile has been shown to directly cause BPD, research suggests that people who have a close family member with BPD may be at higher risk of developing the disorder. Environmental factors. People who experience traumatic life events such as physical or sexual abuse during childhood or neglect and separation from parents are at increased risk of developing BPD. Brain function. The emotional regulation system may be different in people with deep BPD, suggesting there is a neurological basis for some of the symptoms, specifically the portions of the brain that control emotions and decision-making judgment may not communicate optimally with one another. I believe that it's the prefrontal cortex. I believe that people with BPD absolutely, if you were to do a study, have a weakened prefrontal cortex, which is this area right here, which helps to regulate the interaction between emotions and cognition. And so when you have a weak prefrontal cortex, there's no barrier, like your emotions just go right through the prefrontal cortex. So I definitely believe that that is a factor. And the treatments for BPD, psychotherapy, such as, ding, 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 dialectical behavior therapy, cognitive behavioral therapy, and psychodynamic psychotherapy. Those are the first lines of choice for BPD. Learning ways to cope with the emotional dysregulation is key. And in a therapeutic setting, of course, because you need to be surrounded by support, validation, huge, right? Because a lot of times this disorder develops because of growing up in an environment of invalidation. So the validation is very key. And I'll tell you something, and this is the truth, that there have been occasions, it depends upon the client that I'm working with. Let's say somebody comes to me, they're talking about their childhood, they're talking about their symptoms that they're experiencing, and I definitely have come to the conclusion that this person is suffering from BPD and they have no idea, right? I will suggest to them that this might be something that they'd like to look into, that this might be something that they are experiencing. And then I suggest you may not want to tell anyone. Why do I suggest that? Because you tell people, even people in your family, and people will take that knowledge and they will use it against you. They will use it as a weapon of shame, or they will use it in an effort to make themselves feel elevated above you or to put you down in some way, shape, or form. And this happens. It's sad, it's tragic, but people do. People use your struggles in really harmful ways. So this is where I'm at the point where I just don't care anymore. I don't care anymore because I'm strong enough in my recovery that I know the people that love and support me. I only surround myself with people that love and support me, and everybody else doesn't matter. It doesn't matter what they think. The only thing that has held me back up to this point is my job. Because even though I work in a job where my addiction is actually an asset, BPD, I don't know. And there are some people that are going to say, we knew. I mean, they might say that, they might not, because again, I'm very high functioning. I have experienced significant transformation through my practice of DBT skills and especially mindfulness meditation, and having a partner who seeks to understand me and who is willing to support me in ways that help me to feel secure in my relationship, that help me to feel validated, to help me feel supported, rather than just not understanding. And this is, a point in my life too. This is not saying anything negative about anyone else, because he's gotten the version of me that has significantly healed, not fully healed, but significantly healed from this disorder. So some other treatment options. Medications may be instrumental to a treatment plan, but there's no one medication specifically made to treat BPD. Rather, there's several medications that can be used to treat some of the symptoms. For example, mood stabilizers, antidepressants help with the mood swings and the dysphoria. And for some, low doses of antipsychotic medication may help control symptoms such as disorganized thinking. This information comes from NAMI, the National Alliance on Mental Illness. And I chose to share with you from NAMI as opposed to the DSM, the Diagnostic and Statistical Manual of Mental Disorders, because it's organized in a fashion that's easier to understand and consume from NAMI than it is in the DSM. So now a little bit of information about DBT, Dialectical Behavior Therapy. I'm not going to go into detail about this, but I am going to be sharing on my YouTube channel in the private membership area. I am going to, the whole month of September, going to be going through a whole program of DBT for the next 30 days, if not longer, depending upon how long it takes me. And I'll share with you the 2 books that I'm going to be utilizing. One of them is this book, this book right here. And this is Experiential Group Therapy Interventions with DBT, a 30-day program for treating addictions and trauma. And so I'm going to be taking this information and converting it to how you can utilize it individually, like yourself, and also you can utilize it if you're a clinician with groups that you conduct. And I'm also going to be sharing with you some information from another book that is super helpful if you are a clinician. And that is, if I can, it's a really big, heavy book. It's this book right here. Gonna see how big it is. It's huge. So this is the DBT Skills Training, Handouts, and Worksheets. And this is by Marcia Linehan, I'm probably saying that wrong, who developed the DBT program. So relative to DBT, the core skills training that are part of DBT are mindfulness skills, interpersonal effectiveness skills, distress tolerance skills, and emotional regulation skills. And what does dialectical mean exactly? Dialectical takes the position that two seemingly opposite ideas can actually coexist. For example, wanting to be sober, having a desire to be sober, but still wanting to use. Being in love with someone, loving someone, and still being mad at them. For the person struggling with addiction or trauma or BPD, learning to think dialectically helps to minimize the black and white thinking that comes with those disorders. We learn to live in the gray area, and that life is much more the middle of the path than the extremes, which ultimately leads to a much more balanced life. We accept the fact that people may not believe what we believe, may not act like we think they should act, and begin to practice a more middle path, a balanced approach to life, feelings, and relationships. When you're experiencing a craving, you can use the dialectic approach to help you surf your feelings like a wave instead of automatically acting out on every impulse. DBT skills help a person regulate their emotions, tolerate stress, live a more balanced life, and reach their goals through more effective interpersonal relationships. DBT changed my life, and it can change yours too, especially if you're someone struggling with BPD, addictions, or any other trauma. So I hope you'll join me in the month of September when I'll be sharing with you 30 days of DBT skills training. In the meantime, have a very beautiful and a blessed day. Thanks for watching.